I'm Dr. Jeanelle de Gruchy. I'm Director of Public Health for Tameside. Tameside still has a high rate of COVID, unfortunately. It's still over 100 per 100,000, which really is quite high. The rates have been coming down, but the decrease has now levelled off, and we've even seen a slight rise in our case rate. This is similar to other areas in Greater Manchester and the Northwest, but a bit different from the rest of the country, which is seeing its rates going down consistently. So that means that we are in a much more fragile situation in Tameside and in Greater Manchester. We really don't want to see our rates start to go up rapidly again. So I think we're not out of the woods yet, and there is still the very real danger that Tameside may be left behind with needing local restrictions while the rest of the country moves forward with more relaxed rules. And that's really the last thing any of us want. So I'm asking you to please dig deep and keep to the rules. Together we can work to protect our community. It's hard to pinpoint the exact reason for our higher rates, but there are a few areas which I think are contributing to this and where we can all make much more effort to stop the transmission of COVID. Firstly, I do think we have more people who work on the front line in Tameside, so they can't work from home. So we are working hard to support employers in making workplaces COVID secure. It's really important that people who have to go out to work do feel COVID safe. Any businesses who would like guidance on this, please contact us at publicprotection-es@tameside.gov.uk. Secondly, we think social distancing could be better in our shops. Our council compliance teams are busy responding to a number of requests to go out to carry out spot checks at supermarkets and other shops, while also dealing with the workplace outbreaks, giving warnings where there are any issues, but also proactively working with businesses currently closed to prepare for further opening of those businesses and shops to ensure that they are COVID safe on reopening and that we're all safe going into those spaces. But yes, social distancing does need to be done better, I think. Thirdly, people are gathering outdoors, such as informal games or football, and we think people are mixing more indoors, even some having house parties when they shouldn't. This increased level of mixing between people and where social distancing is not being respected is worrying, because that's where the transmission happens. Unfortunately, that's where COVID passes from one person to another, and we have this ongoing problem in terms of transmission. So please help us get the message out to your friends, families, communities, that we do need to continue to stick to the rules now so that we can relax rules sooner rather than later. It will come, but it's not right now. It's important not to mix in other households, to keep up with the hand washing, wearing of face coverings and social distancing to protect yourself and your family and others. On a positive note, the return to schools has gone smoothly, and I think we're all really pleased about that. We've been doing rapid testing with staff in secondary school and college students. There have been some who have not had COVID symptoms, but because of this rapid testing have been found to be positive. They and their bubble would then be sent home to self-isolate, which means that we can then stop COVID being transmitted to others at the schools. We're working closely with the schools to support them with any COVID-related issues. And again, parents and those who care for children can do their bit by not allowing their children to mix with others outside the school and at the school gates. Our COVID vaccination programme continues at an impressive rate, with nearly 90,000 residents vaccinated, and we have seen COVID infection rates coming down in the groups who now already have some protection from the vaccine, which is great. You may have heard about some countries temporarily suspending use of the AstraZeneca vaccine as they look further at safety data on side effects in their countries. Our UK medicines regulator has stressed that there's no proven link between blood clots reported and the AstraZeneca vaccine. All vaccines approved in the UK are safe and effective. I myself was vaccinated with the AstraZeneca vaccine last week, and I would like to encourage all of you who've been invited for your vaccine to please take it up. I'd like to thank everyone who is doing their bit to stop the transmission of COVID in Tameside. It's really, really important that you follow the rules and help keep everyone safe.